Good evening, all. Hope you can hear me loud and clear. It's good to be back. I am Caroline, your host, as always, and it's 8 p.m. UK time, so it is time to start our live event. And once again, I'm very, very happy to have you back here with us. As you can see, Andreia Trigo is once again back with us. Hi, Andreia. How are you feeling
Hello.
tonight?
Brilliant. I'm so happy to be here, Caroline.
We are definitely happy to have you back. And as always, you know that Andrea will start with her presentation, this time on lifestyle factors for successful IVF treatment. I know that Andrea has brought some tips for you, some new things that I'm sure will be useful for you. So just tune in, and of course afterwards it will be time for your questions. So as always, just put those in the chat section so that Andrea can help you out with those. And as always, I want to mention that Stronger Together initiative has been brought to you so that we can support you, we can help you with some questions, but also we want to give you that opportunity to meet top fertility experts, but also life coaches, and also some consultants like authors, like TEDx speakers, like Andrea is, of course. And I also want to mention that Andrea is also founder of the Enhanced Fertility Program. And there is also a new app coming up from Andrea very, very soon. I'm sure she will have a few things to say about that later on as well. And I'm sure you know this already because Andrea is not here the very first time, but also she is supporting our Stronger Together initiative from the very, very beginning, and she is continuing to do that. So thank you so much for this. And as always, you can see all the rest of our ambassadors and partners. So huge thanks again for their support. And I guess we can start with the presentation. And Andrea, ready to begin?
Thank you so much for the introduction, Caroline, and congratulations once again for this amazing initiative that brings so much good quality information and research and experts to patients who are at this time trying to get pregnant at such a difficult time that we find ourselves globally because of the coronavirus. So I think it's an amazing opportunity to patients.
Thank you so
And
much. We're definitely happy to be able to do that as well.
so today, I thought it would be interesting to talk about lifestyle and what kind of factors affect the outcome of your IVF, because I feel that it's something that it's not commonly talked about by a lot of the clinicians, but there is a lot of good quality evidence and research out there that I would like to bring to you today, and maybe it can make a difference to your journey. But for those of you who don't know me yet, I am a fertility nurse consultant, but my journey in the world of fertility started actually at a very young age when I was diagnosed with infertility myself. I was diagnosed with a condition at 17 years old, and I wasn't trying to conceive at the time, but it was very surprising and very shocking, and it was very difficult to cope with it throughout my life up until a few years ago when I've realized that I had coped rather well and I wanted to give back to this community. So I decided to combine my nursing skills with my personal experience of infertility to give something back to this community. And that's when I've decided to create the Enhanced Fertility program that focuses exactly on improving several aspects of your lifestyle, of your health when you're trying to conceive. And today I'd like to bring to you some of those things that you can, in fact, do and modify when you're trying to conceive. And I'm going to talk to you about 6 of those factors. In my research, I found 22 in total, but I'm going to talk about 6 of them today because it's important to start small instead of doing a lot and making big changes. It can be very overwhelming and it can be more counterproductive. So it's good that we start small and make small changes. And it's all all those small changes that will eventually have a good impact on your fertility health and ultimately in your IVF outcomes as well. So we're going to talk about the impact of these lifestyle factors on fertility and conception in general. And we're going to look at the available evidence and current recommendations on these factors as well. I think it's important that we talk about evidence-based medicine. And when we're talking about research studies or even Dr. Google, that so many of us, when we have a symptom, we just Google nonstop. And there's a lot of things online that are not necessarily truth. And there are a lot of things online that are not necessarily high quality research. So you can see this pyramid here on my screen, and it just shows that there are different studies, different research studies that can be done. And the high quality research is what we called meta-analyses or systematic reviews. So these are very good quality studies, and the evidence that I want to bring to you today that you can apply in your life when you're trying to conceive is this kind of research. So we're not looking at individual case reports, meaning one patient that, for example, ate 20 olives a day for a year and got pregnant. We're trying to look at studies that have been done with a lot of patients, so we know that it's likely to work instead of just being one clinical trial or one case report. So in my work at the Enhanced Fertility Program, we've been focusing on modifiable risk factors that are related to your health, lifestyle, habits, and environment, because this journey can feel very, it almost feels like you have lost control, that there's not much that you can do to respond to the fact that you're not being able to conceive. And I wanted to give you back control, something that you could do that could help you in this journey. So I found so far, by reviewing hundreds of research, high quality research papers, I found in total 22 of these modifiable factors. And today I'm going to talk about some of these that are highlighted. We're going to talk about weight and nutrition. We're going to talk about physical activity, caffeine, alcohol, and mindfulness. So I'm sure, I believe I've done a talk here already with my IVF answers on some of the others. And I'm sure there will be an opportunity to continue sharing information. It's good to have information in small bits that you can maybe apply tomorrow. And then once you get used to it, then you can make another change in your lifestyle. So I would like to start exactly with these first two, weight and nutrition, which I know is a very common topic. It's something that a lot of patients try to change when they're trying to conceive. I've done a survey recently, and around 80% of patients were told that they had to either reduce their weight or increase their weight in order to be in what we call the fertile, the fertility zone for weight. The fertility zone for weight is that relationship between your weight and your height that makes conception more likely. And we refer to that as a BMI of 20 to 24. So if you haven't measured your BMI, a very simple way to do that is to Google BMI online, and you'll need to input your weight and your height, and it will give you a number. You can also find this kind of tables online. Here at the top, we have the weight, and here on the side, we have the height. So we can see, for example, 54 kilos, for example, is right here. And the height, let's say 1.62 meters, you would find your number here. It would be a 21. So if it's between 20 and 24, you are in the best weight for conception. And it's important because people who are low weight, for conception can be affected because ovulation might be more irregular. when we are we don't have enough nutrition in our body is trying not to do things that are not crucial for our survival. Crucial things for our survival is our brain, our heart, our lungs. So fertility is usually the first thing to shut down when we don't have enough energy in our bodies. So 20 to 24 would be ideal. What happens when we are above 24 is that our body can also have a lot of hormonal changes that can affect your menstruation. So you might have ovulatory problems as well. So we're trying to move as close as possible to the BMI of 20 to 24. And I know that a lot of people may talk about BMI not being really a good reflection of health, and that might be true because we might see a lot of people who are very muscly and they exercise a lot, and because they have a lot of muscle they have more weight, and then their BMI will increase. However, we need to look at ourselves and just say, is my BMI high because I am very active and I have a lot of muscle buildup, or is it because I'm just a bit overweight? So for everyone who is above the 24 mark, what we know is that moving close, you don't need to lose a lot of weight, but losing at least 5% of that weight can make a very big difference to a lot of people. So I brought here some of the research that says that women who have a BMI of less than 19 and have irregular menstruation or are not menstruating should be advised that increasing body weight is likely to improve their chances of conception. So this is agreed amongst all medical professionals. Women who have a BMI of 30 or over are likely to take longer to conceive, so there's a lot of research on that as well. And women who have a BMI of 30 or over and who are not ovulating should be informed that losing weight is likely to increase their chances of conception. And here, again, you don't need to lose all the weight until you have a BMI of 24. However, losing some of it, even 5 or 10%, might move you closer and might trigger ovulation again to happen in your body. And men who have a BMI of 30 or over should also be informed that they are likely to have reduced fertility. So one of the key things that we can use to manage weight, and I know it's incredibly hard, is nutrition and physical activity, which we will be talking about today. So when it comes to weight, and we talk to medical professionals and doctors, they might just tell you go and lose weight or go home and gain weight. But I do know that it is incredibly hard to do that by yourself. So we need really to find a way that is supportive, that helps people do the changes they need to make in a supportive environment, maybe even in a guided approach by a nutritionist or a physical activity expert. It needs to be a guided approach as opposed to trying it on your own, because that is just very, very difficult to do. So in terms of nutrition, there are 8 things that are really important to do when it comes to your nutrition. And making these changes can actually start changing the scale and trying to move you closer to that fertility zone for weight as well. So these 8 things that are important were found in a very large study by Harvard University that followed a lot of women over several years and started to notice what made a difference when women were trying to conceive. So the first thing that is important is to avoid trans fats. Trans fats are fats that are found in fast food. So if you are eating burgers, pizzas, hot dogs, that will have trans fats in it. Trans fats are also found in products that use hardened vegetable oils. For example, if we use butter to bake cookies or butter to make a cake, that is transformed into trans fats. And the problem with trans fats is that it starts accumulating in your arteries and limiting the blood flow to your organs. And of course, the same way that it can limit the blood flow to organs that are important, like your heart and your brain, it can also limit the blood supply to your reproductive organs. So avoiding trans fats is the number one strategy in terms of nutrition. The second one is to use more unsaturated vegetable oils. So not all oils, not all fat is bad. So we need really to choose what we call unsaturated vegetable oil. So instead of using butter, cream, we're using more healthy oils. We're talking about vegetable oils, nuts, seeds, cold water fish such as salmon and sardines, avocados, olive oil. So these kind of vegetable oils are really good for your health. So if you are cooking from scratch at home, you can prefer to use this kind of oils into your system, and it seems to be good for fertility as well. The third point is about turning to vegetable protein. So research shows that people who eat a lot of protein have more fertility problems compared to people who eat less protein. So we can't eat too much protein. And I think being from a Mediterranean country, for me, animal protein was always the king of the plate. You would always have to have a big piece of meat or a big piece of fish. However, that's not very good. So we're trying to say that we need to eat less protein than a big piece of protein on your plate. And we're talking about vegetable protein being much better for fertility compared to animal protein. So that means that if we have broccoli, figs, avocados, peas, and spinach, we're also getting good protein into our system. So we don't need to have meat or fish on every meal that we have. We can change it and replace it with vegetable protein, which seems to be better. Now, point number 4 is about carbs. And I think a lot of people are afraid of carbs. And when we're trying to lose weight, our first instinct might be to avoid carbs altogether. However, carbs are really important for our health and we need carbs. The key here is to choose healthier carbs. We have different kinds of carbs. There are carbs that are more simple and carbs that are more complex. Simple carbs tend not to be very good. They are absorbed by our system very quickly, and we have a high peak in blood sugar levels, which means we will be hungry again very quickly as well. So choosing carbs that are more complex, that take a bit longer to digest, like whole grains, vegetables, whole fruit, and beans, seems to be much better. We do need carbs. It's just a matter of which carbs to choose from. So if you're, for example, thinking about eating rice, we're going to talk about eating brown rice, for example, instead of white rice, or brown pasta instead of white pasta, brown bread instead of white bread. So changing the carbs you eat will automatically change how these are processed in your body and what nutrients your body can take from it, what energy your body can take from it. So the next thing here, number 5, this research found that people should switch to whole milk when they are trying to conceive. And this is something that researchers can't really explain why we need to switch to whole milk, especially because whole milk has more more fat in it. However, they believe that switching to whole milk might be better because it's a more natural form of milk, a less processed form of milk. And everything that is less processed is better for our bodies. A lot of processed foods means that they come already done or already packaged. They've been through a lot of processes, a lot of systems before they reach your plate and you're able to eat them. Less processed foods are foods that we can eat them in their natural form or almost in their natural form, and there is very little cooking or processing in order for you to eat them. So the less processed food, the best. So we're talking about eating very simple foods that you can cook at home as well. Number 6 is all about taking a multivitamin, which seems to be important. And here, the most important thing is folic acid. So this is the biggest recommendation that is recommended worldwide. And that's to prevent problems that can happen in the spinal cord of babies, which is formed in those very few weeks when babies are being formed, and a lot of women don't know yet that they are pregnant. So we want to prevent those from happening, and it's recommended that every woman, not only those that are trying to get pregnant, but every woman of childbearing age who could potentially get pregnant should take 400 micrograms of folic acid a day, just in case they get pregnant. So there is some conversation between what to take, folic acid or folate, and you can find both in supplements in the market. What we know is that some people's system is not able to digest folic acid as well as folate. So for those people, if you are one of those people, then you should definitely look for supplements that have folate instead of folic acid. They both will have to be decomposed in your system for your system to be able to use it into their natural form, which is methylfolate. So if you find yourself having problems digesting folic acid, then you can buy a supplement that already comes in the form of methylfolate. Then number 7 is about the importance of getting plenty of iron from plants. So here we're talking eating whole grain cereals, spinach, beans, pumpkin, tomatoes, and beets. And finally, it's about drinking to your health and drinking plenty of water, 1.5 liters of water a day. And we highlight here the importance of ditching sugared sodas like Coca-Cola, because they can increase your blood sugar levels a lot. So here we're talking about making water your preferred drink. Then if you have a good nutrition, and I'm talking about eating healthy, I would say most of the time, you don't need to follow a strict diet, but 80% of the time. But so you could move closer to your BMI, your ideal fertility zone for weight, and physical activity can really help you do that as well when we combine a good nutrition that we have most of the time plus some physical activity just to keep our bodies moving. And physical activity, again, is something that matters when we're trying to conceive. We know that too much physical activity is bad, and too little is also not good for fertility. So we need to find that middle spot that is really, really good. So physical activity is defined as any body movement produced by skeletal muscles that requires energy expenditure. Exercise is a type of physical activity, and usually something that you might associate with doing in a gym, that is planned, that is repetitive, that is structured. And usually you have the goal of improving or maintaining at least one component of physical activity. Then we have sedentary behavior, which some of you might have heard about as well, which is about spending long periods of time sitting or laying down when you could be walking or doing something else. So you're spending periods of time of little or no movement. When you are awake, you're just sitting down and you're not doing much activity. And for us, a lot of people might be a real concern, because if we're spending a lot of time, for example, in an office in front of a computer, then we may find ourselves spending 8 or 10 hours a day in front of the computer, and that can be classified as sedentary behavior. So research shows that if we do vigorous exercise, 30 to 60 minutes a day, we have a reduced associated risk. Research also shows that a moderate exercise decreases the risk of miscarriage and increases the chance of having a baby amongst women who had undergone assisted reproductive technologies in this study. Another study found that a minimum of 1 hour exercise 3 times a week improved the rates of implantation and pregnancy and reduced the risk of miscarriage in 436 women who had ICSI. A different study found that low to moderate exercise was also associated with increased implantation and live birth rates in 131 women undergoing assisted reproductive techniques. So what we're trying to say is that either 30 minutes a day of moderate exercise seems to be good, or 60 minutes 3 times a day, 3 times a week seems to be good. But anything more than that, if you're doing, for example, boot camp training for a marathon, working out several hours a day, that seems to be bad for fertility. So things that you could potentially try to keep your body moving would be 30-minute walks, practicing yoga, dancing, leisure bike riding, doing aerobics, jogging, swimming. And some of these things you can even do at home with some videos, or you can join a gym as well. Things that are important to avoid include hot yoga, especially in men, because temperature is very important to consider when we're thinking about spermatogenesis, the production of sperm. Sperm doesn't like a lot of temperature. So hot yoga, especially for men, is not recommended. Bootcamp training, extreme running, or any type of vigorous or strenuous training seems to be avoided. So if we try to combine the physical activity that needs to be moderate physical activity with a healthy nutrition that happens most of the time, then we're giving our bodies the best chance to start ovulating at the right time, that has the hormones balanced right to allow implantation to happen, to allow pregnancy to happen. So that will help with your outcomes as well. Then switching to the other behaviors that seem to be important as well are caffeine and alcohol. So those are two that I think might be part of a lot of adult lives. So it's important to consider whether there is any impact on IVF outcomes or not. So caffeine, we know that it's one of the most psychoactive components, that it's found in a lot of plants. And after it enters the body, it's easily distributed, and it exists in our saliva, breast milk. It's found in embryos, in neonates, and it passes membranes, including the placenta as well. It's good to remember that caffeine is not only present in coffee, but also in tea, chocolate, cocoa products, soft and energy drinks. And I have here this table that has the amount of caffeine in some of these food and beverages. So we can see, for example, filter coffee, 200 milliliters has 90 milligrams of caffeine, an espresso has 80, black tea has 50, green tea has 24 milligrams of caffeine, a can of Coke has 40, plain chocolate 50, milk chocolate has 10, and standard energy drinks 80. So it's important to remember that all of these things that we are putting into our bodies have caffeine. So when we think about reducing caffeine or limiting the amount of caffeine, we can get there in different ways. Or if you want, for example, to avoid filtered coffee, you can, for example, start having green tea, which has a much lower amount of caffeine as a replacement. So we're not trying to get rid of everything. We're just trying to limit our exposure, limit the things that are entering our bodies. The research on caffeine is not clear whether it absolutely affects the chance of pregnancy or not. What studies have found is that women who drink large amounts of caffeine may take longer to become pregnant. So we don't know any more specifics than that. We just know that if you drink large amounts, you will take longer to become pregnant. And the current evidence and recommendation is that we should limit the caffeine when we're trying to conceive to up to 2 cups of coffee per day. And when it comes to alcohol, what research has found is that heavy drinking also increases the time it takes to get pregnant and can affect the developing baby's health as well. So for women who are trying to conceive, the current health recommendations are not to drink alcohol as being the safest approach. And I'm not saying that you should stop completely, but the recommendations are that women who are trying to conceive shouldn't drink. If you want to drink a glass here and there, I'm sure that will be fine, and that will not dramatically affect your IVF outcomes, but just try to limit it as much as you can. And for men who are trying to conceive, it can also affect sperm as well. So they should limit alcohol to no more than 14 units a week, which should be spread over 3 days or more. So avoiding the binge drinking as well. Now, the last bit that I wanted to talk to you about, I was trying to bring you not only the physical aspects of what you're feeding your body with, but also the mind as well. I think it's important for us to consider our body and our mind. Whatever we bring into our system, we will ultimately determine how we live our lives. So mindfulness is something that can also affect our IVF outcomes, and I would like to tell you a bit about it as well. If you're not practicing mindfulness yet, or you haven't ever practiced mindfulness, it's all about paying attention in the present moment, non-judgmentally. So we're noticing what is happening to us, what our thoughts, our feelings, our experiences, but we are not judging what is happening. And we know that the emotional adjustment in couples and women who have infertility is very complex, and people need to deal with the stress of this diagnosis, which is so difficult to cope with. There is usually an identity crisis as well. Who am I? Am I less of a woman, less of a man? What does this mean for my role in a relationship, in society? We know that it's difficult to deal with the ongoing fertility treatment of trying every month or trying multiple IVF cycles and not being successful. So it's an ongoing cycle of hope and then despair, hope and despair, which can be so difficult to manage as well. Couples and women need to deal with the high possibility of unsuccessful treatment cycles. We know that the cycle chance of success is around 30%. So it's not a big likelihood of success. So we need to bear in mind that it might not be the outcome that we want. So how do we cope with that? Couples and women also need to talk about choosing treatment options, which can be so hard when they maybe haven't been in touch with this area. They don't know what kind of treatments are available, and it can look like a minefield of options that are available, and it can be difficult to choose from, and it can be difficult to agree on those if you are in a relationship, how long to try for, what treatments to consider, and you might have different opinions about those treatment options. There is also the uncertainty of the outcomes of consecutive cycles, the non-response, the abandonment, the failure. So all of those are valid concerns of couples and women. And then there's unwanted effects as well, repeated cycles of treatment, the risk of having multiple babies, high rates of miscarriage, limited live birth rates, and other pregnancy risks as well. So there's all these things that we need to adjust emotionally to, and it can be so difficult. So there is something called mindfulness-based interventions that have been researched for people who are going through all of these emotionally challenging situations when trying to conceive. So these are interventions where people go through a series of mindfulness-based exercises when trying to conceive alongside their fertility treatment. And they consist of one session per week of duration. It may range between 8 to 12 weeks. So by the end of these interventions, what research has shown is that women revealed a significant increase in mindfulness, self-compassion, meaning coping strategies. So here we're talking about coping strategies that help you address the emotional distress that comes with it, instead of using other coping strategies. For example, eating unhealthy foods, which I know a lot of us do. When we are stressed, we eat unhealthy, or maybe we avoid certain situations, for example, avoiding other women who are pregnant. So we need to start thinking about the coping strategies that we are using and whether these are helping our emotional well-being or not. So after having been through these mindfulness-based interventions, women revealed that they had a lot self-compassion, mindfulness, and meaning-based coping strategies. And inversely, these women also presented a significant decrease in emotional regulation difficulties, which means that they were able to control their emotions and manage their emotions much better. And active and passive avoidance coping strategies. So this means that they were no longer using avoidance as a strategy to cope with the challenges. So you're feeling more empowered to cope with the challenges. And it's important because it's not always easy to avoid the triggers that are around us. I would say that most often than not, we are not able to control those triggers. So it's a good thing to develop these more useful coping strategies. Research also shows that there was statistically significant differences between participants in the pregnancy rates. So at 6 months after this mindfulness-based intervention, participants were more likely to have become pregnant at 45% than were other people who had not been through the mindfulness-based interventions at 26%. So here we have these mindfulness-based interventions that are not only helping you cope emotionally, but also saying 6 months after 6 months, you are more likely to have become pregnant as well. Other outcomes that I found is mindfulness-based interventions being able to improve infertility-related quality of life, enhanced awareness, increases acceptance, and regain control over life. And I think these are very important outcomes as well, because we all want a baby. However, it's not the only thing that matters in this journey. We want you to be able to have a good quality of life despite whatever happens. We cannot guarantee a baby, but if we can make you feel better about whatever happens next, then that is certainly a good thing. So, quality of life, no matter what happens, is a good thing to develop. Research also shows that these mindfulness-based interventions improve the psychological well-being of infertile women, including their self-acceptance, their positive relations with other people, autonomy, environmental mastery, purpose in life, and personal growth. In another study, women who attended the program revealed a significant decrease in depressive symptoms. And I know that a lot of women, around 90% of women trying to conceive, tend to have depression. It also decreased internal and external shame, which I know is so common, entrapment and defeat. And inversely, women presented statistically significant improvement in mindfulness skills and self-efficacy to deal with infertility. So we have here the last two studies where these mindfulness-based interventions led to a reduction in emotional distress, pain perception, depression, and anxiety after 3 to 6 months of continued practice. And the last one, where women in the intervention group, so the ones who went through the mindfulness-based intervention, had significant decrease in anxiety, depression, and stress, and were 4.5 times more likely to become pregnant than in the control group. So here we're talking about doing something that can be quite easily to do, that can also help you not emotionally, but physically as well, and ultimately with the outcomes of your fertility treatments. If you haven't practiced mindfulness yet, I would say that the easiest way to start is to start noticing your routines, the things that you do every day. For example, brushing your teeth, and you start doing it mindfully, which means that instead of doing it in automatic pilot mode, you are noticing with your five senses, you're noticing what does the toothpaste look like? What is the color? What is the smell? And what does it feel like when it touches your teeth? What teeth are you washing first? So just noticing mindfully, not judgmentally, all these routine things will help you starting to develop mindfulness in your day to day. Then you can start doing mindfulness, for example, when you're eating, noticing the color of your foods. How many colors do you have on your plate? What is the smell? What is the texture? Noticing all those things with your five senses. You can apply it to your relationships as well. So when you're having intercourse with your partner, you, instead of thinking whether his sperm is going to meet my egg and I'm going to get pregnant today, just be in that present moment, noticing your partner, the skin, the smell, how it feels in your body as well. So that's like the easiest way to practice mindfulness. If you have done some of this already, I would say that the next step would be to start listening to some of these mindfulness-based interventions where you listen to maybe a 5 or 10 minutes recording. You can find them online on YouTube as well. And you can do different kinds of mindfulness recordings, either to manage emotions or to build confidence or for goal setting. So it can be incredibly, incredibly powerful. So the key takeaway points today, we talked about 6 of the lifestyle factors that can have an impact in your fertility treatment. There are a lot of things that can make a difference, and the truth is that there isn't one perfect formula that works for everyone. Otherwise, everyone would be pregnant. So there isn't that formula. So things that might have an impact on someone might not have an impact on someone else. So it's important to consider evidence-based practice. Things that have worked for a lot of people are more likely to work for you, as opposed to trying something that a neighbor has tried and worked for her, but doesn't have a lot of research behind it. So having a healthier weight that is within that time frame can help you um, be in that fertility zone for weight. If you're not there yet, just try and move closer. You don't need to feel overwhelmed or give up because you're so far away. You can start by having small steps and start to move closer to that fertility zone for weight. Nutrition and physical activity can really help you get there. In terms of nutrition, we talked about having a generally healthier diet, which I think a lot of us kind of forgotten. But if we start thinking about the basics, I think what I've talked about today is not something really complex, but I think we need to maybe go back to basics to start thinking, what am I putting in my body? Is this giving me the nutrients and the energy that I need so that my body and my organs do what they need to do? In terms of physical activity, is that that middle ground where you're not over exerting yourself, but you're also not in sedentary behavior. Is that middle ground, 30 minutes a day or 1 hour 3 times a week of moderate intensity activity? Caffeine is about limiting it, so up to 2 coffees a day. Alcohol, ideally none, but a glass of wine here and there won't harm you, and it will be okay. And mindfulness is all about making sure that you are able to cope with this emotionally challenging situation, because the distress of what you're going through can also affect the behaviors that you have when it comes to nutrition, physical activity, alcohol, and caffeine. So you might be doing really well, but if you are stressed or depressed, you are more likely to do the things that can harm your fertility. So mindfulness can bring it all together. And I'm really, really coming to an end where I can answer all your questions. I just wanted to end by showing you a snapshot that I haven't showed anyone yet on my social media, but this is the Enhanced Fertility Program app that is coming up in November, where I'm bringing all of this information and these strategies to your fingertips. So everything that you need to know when it comes to your fertility, conception, fertility treatment, nutrition, physical activity, environmental factors, managing emotions, all of it is in an online course in this app with a lot of recipes as well that you can use, support groups, all of it. The app is free. It's coming in November, but I'm giving early access to some people. So if you want early access, I'll send you a link here in the chat box that you can follow, and you'll be able to have access before everyone else. So I'm really, really excited about this. And I am happy to take some questions, Caroline.
And thank you so much, Andrea. That was definitely interesting. As always, you have provided all kinds of tips and details in regards to the things that matter. And of course, we definitely have some questions on that. So our patients were definitely listening and they just have some questions in regards to your presentation. So I'm very happy about that. So thanks a lot, Andrea. It's always great to have you as our presenter, that's for sure. And as you can see, more questions are coming up, so let's just not waste time anymore and let's go with the very first question we have. So, is a BMI of 27 acceptable?
Yeah, so like I said, the ideal BMI for conception is up to 2024. However, if you are at 27, what you can do is try and see in your diet or in your physical activity if there's anything that you can change. I think if you have a 27, but if you have a regular menstrual cycle and if you don't have any fertility problems, then there's nothing wrong with having a BMI of 27. But if you have irregular cycles or ovulation problems, moving from 27 to a bit lower down can definitely move you closer to having a more regular ovulation and making it more likely to conceive.
And wonderful. Thank you so much for answering that one. And I just want to mention that, of course, Andrea has just sent you a link. So just go ahead and check it out. This definitely sounds interesting. You will be able to simply use it and, find out what Andrea has already told you a little bit on as well. So there is also one comment on that. So great idea with the app. I would love early access. So as you can see, everyone is
Absolutely.
pretty excited about it. Thank you so much. Okay, and let's have a look at the next question that we have right here. What is the best BMI for surrogate to have our
Mhm.
embryo implant and lead to a healthy birth for both surrogate mother and baby? Anything she should do differently to if a natural pregnancy would occur?
That is a great question, Angela, because we're talking here about a third person, right, carrying the baby. But there is nothing too much different that she should do compared to a natural pregnancy. So her BMI would still ideally be between that range, and just having a naturally healthy nutrition, like we were talking about, because everything that she eats is ultimately the energy and the nutrients that the baby will get. And if she needs to take absolutely all the multivitamins and the folic acid as well. So a normal natural pregnancy would follow those same recommendations as well. But if you're choosing a surrogate with a healthy BMI would definitely be better for the baby and also for her, because increased BMI comes with all sorts of pregnancy risks as well for the surrogate, in terms, for example, of high blood pressure during pregnancy, which can be a very big problem, or the risk of diabetes or increase of having a baby with low or high weight. So if you are choosing a surrogate, choosing someone who has that uh, healthier zone for BMI would be the best choice, Angela.
And excellent again. So thank you so much for your question and of course your answer to this one as well. And there are some questions like that. Is it okay to eat a lot of eggs, corn? Anything you can advise on that?
Corn, absolutely fine. Eggs, it's also okay to eat eggs. They are a good source of protein. I don't know what we mean a lot, right? So a lot for someone could be eating one egg every day, but for someone else, it could be eating, I don't know, three, four, five eggs a day. So it just means what a lot is. But using an egg as a replacement for example, animal beef, two eggs a day, and are you doing it as a replacement of other sources of protein? Yeah. So that should be fine. Yeah. And corn is fine as well. So it comes in a very natural form. So you can either boil it or you can stick it in the oven, and there's not a lot of processing to do with corn, so you can eat that.
And again, thank you so much for that advice. And as you can see, there is a thanks from Margie as well. And I will go back to the previous question, Angela's question, in regards to surrogate mother. So, surrogate mother has BMI of 22 and she gave birth to her own child only 15 months ago. Is this okay?
Yeah, that's fine. So BMI of 22 is okay. And she has given birth 15 months ago. So her child is over a year now, a year old. So yeah, that's absolutely fine. Good luck, Angela.
Okay, again, thank you so much for that as well. And this is in regards to your presentation, indeed, as well. So, which is better, folic acid or folate?
Yes, that's a question we get quite a lot. If we look at the recommendations, the medical recommendations worldwide, they talk about folic acid. And in a sense, that's what most research has been done is on folic acid supplements. So that's what they end up recommending. But it's not only about folic acids, it's all about eating the green vegetables that can give you folate in the natural form. So we're eating these green vegetables and we're taking a folic acid supplement. Now, I said that some people do not process folic acid as well as other people. And this might be tested with a blood test to see if it's building up in your system, if you're not being able to process it. So I would say it would be best to have supplements with folate if you don't know if you are processing it or not. So you just need to look at the supplements that you're taking and see if they say methylfolate or if they say folic acid. For the majority of population, folic acid will be fine, but there's a smaller percentage of people who are better taking methylfolate supplements.
And wonderful. Thank you so much for explaining this one. Definitely comes a lot. And well, there are like two questions, very same one, and you have mentioned that, okay? But let me show you. How do you know whether your body can't process folic acid? You have mentioned that. And the next one, actually, how do you know that your body has problems absorbing folic acid and when to switch to folate? So, in a way, you have answered that as well.
Yeah, so you can do a test to see if you are being able to process it or not, if it's building up in your system or not. So that's something that usually a nutritionist or even your GP could request that test to see. Or you can just start taking supplements that have methylfolate instead of folic acid as well.
And again, thank you so much for the clarification once more. Next question is cheese okay to eat in moderation?
Yeah, so cheese has a lot of those unhealthy fats. So it's okay to eat a small bit of cheese or maybe choose cheese that is lower in fat. Um, it would be best. So not to eat every day, but here and there it should be fine. Like I said, I don't want you to avoid everything or to thrive for an ultimate diet that is impossible to maintain. It's best to make small changes and eat healthy 80% of the time, and still 20% of the time allow yourself to eat the things that also bring you a bit of joy to your life. We're trying to do something that we can maintain long term as opposed to doing a crash diet for a couple of weeks. That is not good for your body. We want to try and find something that works long term.
And once more, thank you so much for a thorough explanation to this one. as well. And we have more of those questions right here. So, like, is drinking green juice, ginger, parsley, lemon for cleansing before IVF okay?
I'm not really sure if the green juices do cleansing. I think our body is particularly good at cleaning yourself itself and eliminating the toxins, usually via urine. Uh, so we don't need to do any cleansing, but the green juices can be a good way of giving our body some of the things that maybe we're not eating. Maybe you wouldn't eat all the vegetables that you've put in that green juice on your plate. So if you struggle with that, then a green juice with all the greens or some of the fruits. So some of those that we should eat 5 a day. If you are struggling to eat them throughout the day, we can put it in a green juice, and it's much easier to digest in that way. So you can do that as part of a general balanced diet, but not with the intent of cleansing.
And again, once more, thank you so much. All right, next question is walking 1 hour or more during IVF okay?
So doctors will advise you what to do. Some doctors will tell you not to exercise at all. Others will tell you to continue doing your normal life. 60 minutes of moderate exercise 3 times a week is generally okay. But if you are having, for example, embryo transfer, so maybe that day you should just do things that bring you joy, but not necessarily go to the gym and exercise really hard. So it's okay to walk 1 hour as long as it's slow paced. But if you're doing moderate paced walking, maybe just do it 3 times a week if you're doing 1 hour, or do it every day for just 30 minutes. I hope that has explained a bit. I know it's tricky to find that medium term in terms of physical activity.
All right, wonderful. Thank you so much for that. And next question is regards to caffeine. So, does caffeine impact the quality of eggs, or should it only be avoided shortly before or during transfer?
So we don't know. Research hasn't nailed it down what exactly the impact is, but it shows that if you take more than 2 coffees a day, the time to pregnancy seems to be longer. So I'm thinking that it maybe affects some of those steps before before implantation has happened. So it's best to stick to up to 2 cups of coffee a day advice, even before transfer.
And so once again, thanks a million for yet another one right here. Next question is: what's your advice on beauty treatments such as Botox or fillers when trying to conceive? Does it have impact on equality or implementation success?
That's a great question, and I haven't looked into that, to be honest. So that's maybe something that I can look into. It's not something that has come up in my practice yet. Uh, but I can look into that, Patricia, and then I can send a message to Caroline to see if there's any research on beauty treatments and egg quality or implementation success.
Yes, okay, that sounds great. Of course, we can do that. We can definitely check it, and of course, I know that Andrea will be more than happy to have a look. It might be helpful, for
Yeah.
sure. So thanks a lot for that question, for sure. And let's have a look at the next one. There might be a month between my egg collection and transfer. How important is it to eat super healthy during that month? Can I relax a bit from my strict diet now, or shall I continue it?
That is a great question. I think you don't need to have a super healthy, strict diet. but try to eat healthy 80% of the time. That's what I would say, because we don't want to all of a sudden, just before embryo transfer, to start drinking, I don't know, 4 or 5 cups of coffee or getting drunk or anything like that. So I don't think you need to be super healthy. I don't think you need to be super strict with your diet now. uh, you can allow yourself to relax a bit, but not to go completely overboard to the other end. Try to find something that works for you and that maybe you can maintain now and even when you have your baby. Something that you can pass on to your baby as this is good for you, this is good for us as a family to do 80% of the time or most of the time.
And understood. Once again, thank you for that. And there are like few questions left. We will be slowly finishing. So if you have any left, just go ahead and type those in. And now a question that definitely comes up quite a lot as well. That's taking CoQ10, vitamin D and A, C help and how much?
Yeah, so those are antioxidants. Coenzyme Q10 is an antioxidant which can be helpful. We haven't talked about oxidative stress today, but it's one of the factors that can affect fertility, mostly male fertility. And the reason why it can affect is because our body produces these toxins as each cell works, and our body has a natural detox system that gets rid of those toxins. However, sometimes when our body produces a lot, for example, if we have an infection or a medical problem or a disease, or sometimes when we are exposed to certain environmental factors, for example, smoking, drinking, eating unhealthy, certain pollutants in our environment, we are producing more toxins in our body, and our cells may not have the ability to get rid of those toxins with our natural detox system. So taking certain antioxidants seem to be helpful, and it helps more men because sperm are particularly sensitive to the oxidative stress problem. So I would say that coenzyme Q10 can help. Um, it's not the formula that will help everyone, but if you are particularly exposed to certain factors that cause oxidative stress and you're not being able to limit your exposure, and the key is always limiting the exposure to oxidative stress as much as possible, then taking coenzyme Q10 can help as well. Vitamin D, again, can also be helpful, particularly if you are in countries where there isn't much sunlight as well. So it's just finding what works for you, um, and what are your specific body needs in terms of the things that you are exposed to, the things that you cannot change by lifestyle, and taking some of these supplements can be helpful.
Once again, thanks a lot for that. There are like two questions left. Next one is, should we avoid red meat?
Yes, that's a simple question. Yes. So red meat has more saturated fats that accumulate in our arteries. So if you are eating meat, it's best to eat simple meats like turkey or chicken. White meats seem to be better.
And wonderful. Thank you so much for your answer once again. And well, it seems that now it will be our last question for tonight. So let's have a look at it. So, is decaffeinated coffee not harmful at all?
I'm not sure if it's not harmful at all, but it has less caffeine in it. So, in that sense, I think it would be a good replacement for someone who maybe feels they need to have that coffee taste, for example, in the morning, switching might to decaffeinated coffee might be a bit easier than just cutting completely. So I think it's definitely trying to find solutions that work for you, that don't leave you completely overwhelmed, instead of finding a very strict diet, a very strict regime that then you're not able to do, or that leaves you more stressed or overwhelmed about the whole journey. Finding small changes that work.
All right. Once again, thank you so much. And actually, there was a comment in regards to red meat, so maybe you can
Mm.
add something. So I was suggested to eat red meat because of my anemia.
Okay, so again, I think that is a completely different issue. So if you have anemia, that means that you have a low blood count. There are different ways of increasing your blood count. Um, for example, by taking some supplements, some tablets as well. So I wouldn't want to contradict what the doctor has advised, but I think number one, we need to look at why is your blood count low? Are you losing blood, or are you producing less blood? So that definitely needs to be a reason for that. And maybe we need to find a way of increasing that. And depending on how low your blood levels are, there might be different solutions. But I don't think eating red meat might be the only thing that can help you with that. Um, but this is completely separate to fertility issues. So it's not something that we would, how can I put it? It's not necessarily a cause for your fertility issues in terms of when we're talking about anemia. But I think we need to look at the bigger picture. What is the value of your blood levels at the moment? What is causing the anemia? And then what can be improved? But I think you'd need to go back either to your GP or to your doctor to have an overall look at that. So that's not something that me as a fertility nurse I would be able to advise.
All right, thank you so much. And actually, there's a comment right here. So, yes, I am taking iron pills, and
Mm,
anemia is because I have heavy monthly bleedings.
yeah,
Okay.
yeah, that does make sense. And when you're taking iron pills, it can take months to level up your your blood levels as well. So it can take a long time. But maybe what the doctor should be doing at this time is to look at the reason why you have very heavy monthly bleedings. What is the reason behind your heavy cycles? Um, yeah, so I think that could potentially be something for a gynecologist to look into.
All right. Again, thanks so much for this. And there are like two parts of question. Okay, so how soon before treatment should we start the diet, and is it healthy to lose some weight, 2 or 3 kilograms short before starting the treatment?
So I would say a healthy lifestyle, ideally 3 months before treatment, because it takes overall 3 months of doing something routinely for us to start noticing the impact on our bodies. When we think, for example, about sperm formation, it takes 74 days, so roughly 3 months, to form new sperm, and whatever we are exposed to or eating at this point will affect the sperm that is collected in 3 months' time to be used in treatment. So, in terms of our eggs, in every cycle, we also depend on our hormones that to trigger our follicles to grow, to trigger the main follicle to ovulate. And so we need to have our hormones balanced. And that again depends on what we eat. So if you allow yourself 3 months, that would be ideal. So you can make sure you have the best possible eggs and sperm for the doctors to have treatment with. Now, losing weight quickly is not good because your body will immediately shut down your reproductive system. So we don't want you to lose 2 or 3 kilos in a week. Okay, so it depends what we're talking about short before starting treatment. So we want to lose weight in a healthy way. So if we're talking losing 3 kilos over 3 months, that's absolutely fine with a healthy, balanced diet, making sure that you're still giving your body the nutrition it needs. We don't want to do any crash diets that will put your body into a survival mode.
And amazing. Thank you so much. That was definitely our final question. However, I would like to thank all of you for all your questions. And of course, Andrea, as always, you have been brilliant with answering all those details you have provided. It's been definitely useful to know and to hear, of course.
Mm.
And well, there are plenty of thank yous coming up right here.
Thank you.
So I can only show you some of those. Thank
Yes,
you for today. Very useful and looking forward to trying your app. Thank you very much. As you can see, more and more of those coming up. So very
thank you
informative.
so much.
Thank you as well. And well, we will be finishing. Andrea, is there anything else you would like to add?
Well, I would like to send just a big hug to everyone who has chosen to be here today and for all your questions. I know this journey is super, super hard. So give yourself a break. Don't try and make all the changes at once. It's really hard. We all know that. So small steps towards the right direction will have a bigger impact at the end. So just do what you can and just give yourself a break. You are already doing amazing work.
Exactly. Thank you so much. And as you can see, big hug back at you. So thank you so much for your kind words, everyone, for showing up here almost every single day. I know some of you are actually joining us over and over again. So I'm very happy that we are able to help you out, to support you as always. And we will continue to do so. And Andrea, this is always a pleasure. It's always great to cooperate with you. So there are more and more of those events coming up with you. I am sure of that. So
Yes.
we are in touch as always. And of course, just remember this has been recorded. You will be able to find it on myivfenses.com. It will be uploaded tomorrow. And of course, if you go to our YouTube channel, there are plenty of previous events, but also this one will be right there. So don't hesitate and subscribe to our YouTube channel. And if you follow us on Facebook or Instagram, you will know all about our upcoming events as well. And there is one more event, of course, coming up with Andrea on the 4th of November. So stay tuned. And I hope to see you all here as well. Andrea will have another great topic. I have no doubt this will be interesting for you as well. Thank you so much, everyone. Have a lovely evening or day, wherever you are, of course. And well, thank you. Good night. Bye.
Bye.